So what is the role in Pancare in this? And we have a few things we like to really strengthen, a lot of them. And with a lot, I mean like over a half, but you also can find the number of 2/3 experience some kind of long-term health related problems.
I joined the working group of Fox 2 because I'm a survivor myself. And it felt good to be surrounded by others who have gone through similar experiences. Way back. What do you think has changed, in your opinion, when thinking about long-term survivorship care?
Well, I think when I came out of treatment, that was over 20 years ago, and there was first some sort of long-term follow-up care a few years after the end of treatment. But I think that was more or less like, okay, how are you feeling now? And you're out of treatment, so hopefully all will be fine. And I think the most important change for me is recognition of the fact that late effects exist, that there are late effects, and that also opened up for more research opportunities and more knowledge about late effects.
Touched upon this survivorship care. Why? I think the rationale is clear. 75% of 5-year survivors have a late effect treatment related to treatment.
Paradigm shift mentioned by you, Katrin, before, and Giulio D'Angio wrote a groundbreaking work called "Cure is Not Enough." The quality of life is there, and it's important to talk about quality of life. And since 2006, we a wonderful and unique network, which is called Pancare, group of collaborators across Europe, has been gradually formed to help improve the quality of life of our patients, which is fantastic news. We try to be positive. Sometimes it's difficult, but we try to focus on positive aspects of survivorship. People who really had existential experience in the past, who are so positive, and we learn from all those unique people coming to our outpatient clinic. So for me, it's important to maintain the positive spirit of the team, and teamwork is the base.
I think what's important for me was the acceptance, or accepting the fact that after the treatment it's not over, and a lot of things was already mentioned about long-term side effects and everything. And I think that our clinic that I'm now part of, the long-term follow-up clinic, have really amazing people there. Like you, for example, Dr. Kepák doesn't even know that, but I call him my guardian angel. But all the nurses and everybody there, it is really a place where I feel safe. Not only that I'm taken care of, but my mental health is considered as well. It was also mentioned at the beginning that it is very important for a lot of people. So I think that is really important to mention. And yeah, I very much appreciate the personalized care, all the information that I have. And maybe the main message I would like to say is that knowledge is power. So I think that being informed and having control over your follow-up care is the most important, at least from my experience.
And the caregivers, and to create European guidelines and empower cancer survivors to advocate for their rights and needs. And this project is divided in several work packages, and for late effects and long-term follow-up care, we focus on the work package 3 about quality of life, and we as Pancare are especially involved in late effects and long-term follow-up care.
So the topic in February will be transition of pediatric to adult care, and then in March on fertility and sexuality. Now please enjoy your evening and take good care of yourself.